Hello, hi, it's Dr. Erica. Thank you for joining me on this particular video. I am elated to go over this video with you on today. I am Dr. Erica Onagbola, owner and founder of Millennium Pharmacy. I have a website, www.themillenniumpharmacy.com, www.themillenniumpharmacy.com. So please do check out my information and products. Also, I'm on TikTok as well as Twitter as well, uploading educational information. I am a pharmacist for close to 10 years, and I have been in practice. I've been the owner of Millennium Pharmacy since 2018. So I am elated to go over any information, topic discussions that you may have. Also, discussions about not only medications, but disease states, newly approved medications that have come out on the market in pharmaceuticals. I'm also interested in research topics as well. So do please leave suggestions that you may have, and I'll be happy to go in further into that information, okay? So again, this particular video is about strep throat. It's part of the eyes, ears, nose, and throat series that I came up with, and I thought it would be very relevant, especially during the cold and flu season, to talk about disease states that are prevalent during that particular time of the year and seasonal changes. So we have allergy season that's coming up in spring. We're just getting over cold and flu, vaccinations for COVID, influenza as well. So this is very relevant. And so I'm glad to go over this particular topic on today called strep throat. Strep throat is also known as pharyngitis. It's caused by a bacterial infection. Usually there's tonsils involved that are infected, bacterial infections that can be treated non-pharmacologically and pharmacologically with antibiotic treatments. With pharyngitis or pharynx infection, this could escalate to other disease states such as rheumatic, heart disease, which we don't want. We don't want, if we can captivate this particular disease state and get it under control with antibiotics within a few days of symptoms, then that's what we're going to do as healthcare providers. We don't want this to escalate to further heart disease and such when it can be eradicated. So symptoms usually happen very fast within 5 days, and then they decrease over 2 days after medication. Okay, so there's also antigen testing that is performed for diagnosing. There's a swab test that is going to help with diagnosing as well, to provide a culture and a sample of the bacterial infection type so that specific antibiotic therapy can be rendered. So that is very important at the initial state. You want to make sure you understand, doctors understand, and nurses understand what they're dealing with before they begin antibiotic treatment. We also know as healthcare providers that antibiotic treatment has become resistant to a lot of strains of bacterial and viral infections. And so with getting to know what is actually being cultured, what is actually being growing in the throat, then we can understand exactly how to treat with the appropriate antibiotic therapy. Okay, so patients may feel symptoms that may be mild to moderate to severe. In children, children may experience abdominal pain, they may experience vomiting, GI upset, things like that. Adults maybe feel pain in the throat, redness and swelling. They may experience swollen tonsils, a swollen pharynx in the throat area. Difficulty swallowing can be a symptom as well. Also, enlarged lymph nodes, joint pain, and muscle pain as well. So those are some of the symptoms. Also, because there's an infection, the immune system will begin to let the body know that there's an infection by increasing the body's temperature, causing fever. Okay, increased temperature, increased fever, that lets you know that the immune system is working to fight off this infection. Again, so do be aware of that. Treatments can be tonsillitis or tonsil removal, I should say, with recurrent tonsillitis recurrent pharyngitis, then we want to consider removal of the tonsils because that could be a risk or factor causing this particular infection. Also, there's treatments such as lozenges that help with topical anesthesia or anesthetic properties. That can be also menthol sprays that are over the counter that could be used as well. They might help with symptoms for a small bit of time, but eventually, again, you're going to need pharmacological therapy, antibiotic use. Now, most patients can use Tylenol for pain, which is better than any NSAID. NSAIDs are known to cause a shock reaction, and so it is best to use an Tylenol or acetaminophen generic to help with pain as well, if swallowing is okay at this particular point. Then there's also antibiotics, Penicillin V. Penicillin V is the go-to medication, and this particular medication is dosed at 500 milligrams twice a day for about 5 to 10 days, usually 10 days, to make sure that eradication is complete. Although symptoms may subside after a couple of days, it's best to go ahead and continue with the medication regimen to make sure that eradication is there. Also, this particular medication does cause allergic reactions to some people, such as hypersensitivity. In that particular case, clindamycin or cleocin is rendered as an alternative, and also macrolide class of antibiotics may be used as an alternative as well. And then for recurrent situations, clindamycin or cleocin is rendered, and again, other antibiotics to help with GI side effects, to help reduce the GI side effects, also to help reduce recurrent infections as well. So do be on the know about that. There are some cephalosporin second and third class generations that are appropriate when there are specific types of bacteria that are causing this infection. But usually the go-to medication is going to be penicillin V, 500 milligrams twice a day for 10 days. All medications that are given antibiotic therapy is continued for 10-day purposes. That way we make sure the antibiotic is working and then the infection is cleared. And then dosing is never going to be a once a day dosing, usually, just because the research has said that twice a day dosing, up to 4 times a day dosing, will help better eradicate. So that is usually the guideline for treatment. Multiple times a day dosing, up to 10 days, or at 10 days therapy for completion. Also, to decrease the chances of symptoms being contagious, because this disease state is contagious, go ahead and take it for the full amount of time. Suspensions should be shaken before use, such as with the augmentin, also with other medications that may be given to help with swallowing. As a suspension, shake well, take on an empty stomach preferably to help increase absorption. Also take with a full glass of water, 8 ounces of water, 240 milliliters of water per dose per day with the tablets, to be sure that this medication is getting where it needs to get. Also, I have a video on fluid requirements, so do watch that video as well. It talks about medications that require fluids, and also this is a chance to review that particular video, because this antibiotic class will require fluids with consumption. So do be aware of that video as well. Please visit my other videos that I have that are very relevant to get to know your pharmacist, to get to know your medication, therapy, and regimen better, to understand your disease state that you may be dealing with, the family may be dealing with. Also, there are new uploads on a daily or weekly basis as well. So do please visit those as well. Please like, share, and subscribe. And I thank you for joining me on this particular video. If you have any questions or comments, please see the description, and I'll be happy to visit you on the next video. Thank you for joining me. Bye-bye.